Start. Welcome back, guys. Now let's begin our topic of Starling forces. So what exactly are the Starling forces, sir? Let me explain you. Let's look here. Here I am showing you a glomerular capillary. This is the glomerular capillary. And down to the glomerular capillary, what do we have? Bowman's capsule and proximal convoluted tubule, we all know. So what exactly are the Starling forces? Let me tell you. See, here in the glomerular capillary, this is the glomerular capillary, right? Here there will be plasma. Yes or no? There will be plasma, sir. Because of this plasma molecules or the water molecules, there will be development of hydrostatic pressure. So because of these water molecules, whatever were there here, there will be development of what? Hydrostatic pressure. Means these water molecules, they are exerting pressures on the wall of the blood vessel. They are exerting the pressure on the walls of the blood vessel. So this pressure is called as a hydrostatic pressure, and I am representing this hydrostatic pressure as PGC. Hydrostatic pressure in the glomerular capillary, PGC. And how much is that value? The value is 60 mmHg. Okay, 60 mmHg. Tell me, this hydrostatic pressure, what it is trying to do? See, it's always trying to move the plasma out of the blood vessels. This pressure, it's always trying to move the plasma out of the blood vessel. Means into the Bowman's capsule. So tell me, is it favoring the GFR or is it opposing the GFR? It's a favoring force. It helps in the filtration. So always remember, wherever there is water or wherever there is plasma, because of this plasma, what kind of force is developed? There is development of hydrostatic pressure. Even look at here, in this water bottle, see there is water, right? So these water molecules, what they are exerting the pressure on the wall of this water bottle. They are exerting the pressure on the walls of this water bottle. So that pressure is called as what? Hydrostatic pressure. And what this hydrostatic pressure always want to do? It want to move the water out of the blood vessel or plasma out of the blood vessel. Okay. For example, see when I keep a small hole over here, immediately the water will come out because of that hydrostatic pressure. So hydrostatic pressure always wants to move the plasma out of the blood vessel or the water out of the blood vessel. Okay. Done. Now, there is one more force called as the oncotic pressure. So what exactly is this oncotic pressure, sir? Oncotic pressure is because of albumin. Okay, oncotic pressure is because of what? Albumin. So plasma is the one responsible for the hydrostatic pressure. Albumin is creating a pressure called as the oncotic pressure. See, try to understand it like this. Albumin is like a sponge piece. Imagine it like a sponge piece. So what this albumin always want to do, it is trying to create a pressure called as oncotic pressure, which is trying to hold the plasma within the blood vessel. Okay. So this is creating an opposite force. See, I am using the green color. Tell me, this albumin is using opposite force called as the oncotic pressure. One force, hydrostatic pressure, wants to move the plasma out of the blood vessel, but the oncotic pressure, it is trying to hold the water within the blood vessel. And I am representing it with pi. Okay, letter pi GC. That is the oncotic pressure in the glomerular capillary, and its value is 32 mmHg. So now you have to tell me, sir, how many types of forces are there? There are two types of forces. One is a favoring force, other is opposite force. One is favoring, other is the opposing force. One favors the filtration. See, one favors the filtration, other opposes the filtration. Done. How to understand it, sir? Let me give you an analogy. Imagine you are a married guy. Now you are living with your mom and your wife. See what always mom will do. See, you are a doctor, right? Your mom is always saying you are working so hard, you are going to the clinic in the morning, you are coming late in the night. So all the days, 24 by all the days, 7 days a week, you are working. So why don't you take some rest? You stay in home, I will take care about you. Okay, I will cook for you. Okay, your mom always wants to keep you in the home. She always wants you to be in front of her eyes. So mom is like oncotic pressure, guys. Okay, mom is like oncotic pressure, always trying to hold you in. But what your wife will say? Wife will say, no, you go out, you go and work for me. You get me something. Okay, you get me some nice phone, you get me some nice bag, you get me some nice watch. So wife is always trying to kick you out. Your mom is trying to hold you in. So these are two opposite acting forces, right? In every family, there are these two opposite acting forces. In the same way, in our blood vessel also, two opposite acting forces are there. One is the hydrostatic pressure, which is trying to favor the filtration. Other is an opposite force, oncotic pressure, which is trying to oppose the filtration. So now who is mother and who is wife in this? Oncotic pressure is like your mom, trying to hold you in the house, within the blood vessel. Hydrostatic pressure is trying to kick you out. Okay, done. Now, look at the Bowman's capsule now. See, in the Bowman's capsule, again here some fluid will be there, right? Okay, whatever the urine that is filtered, the urinary ultrafiltrate, here it will be there. So, as the fluid is over here, as some water is over here, definitely there will be development of hydrostatic pressure. So, here also there is hydrostatic pressure. Now, I am representing it as PBC, hydrostatic pressure in the Bowman's capsule. Now, you tell me, these water molecules, whatever is present over here, they will also try to show the pressure on the walls. Okay, they will also creating the pressure on the walls, guys. So, this hydrostatic pressure, you tell me. So, this hydrostatic pressure, okay, is it favoring the filtration or opposing the filtration? So, these water molecules want to move in this direction. So, they are opposing the filtration. They are acting like a resistance for the filtration. Okay. So, now I am showing the arrow in the upward direction. The hydrostatic pressure here, it is a opposing force. And what is its value? The value is 18 mmHg. Okay, 18 mmHg. Now, here there is also oncotic pressure. Oncotic pressure. And oncotic pressure is because of what? Albumin. I have told you very less albumin is filtered. Very least albumin is filtered. So, the oncotic pressure, you tell me. Because of albumin, whatever is present over here. Okay, because of the albumin, whatever is present over here, albumin, what it will try to do? It will try to absorb the water. It will try to hold the water. Okay, it will try to drag the water. So, whatever the albumin which is present over here, it will try to pull the water. It will try to pull the water. It will try to favor the GFR. So, the oncotic pressure here, it is a favoring force. It's a favoring force. Okay. So, now tell me, how much is the oncotic pressure? See, there is very less albumin over here. So, because of that very less albumin, the oncotic pressure, whatever is developed over here, is very negligible. So, we are considering it as 0 mmHg. Okay, 0 mmHg. So, now you tell me, how many types of Starling forces are there? There are two types of Starling forces. One is hydrostatic pressure and oncotic pressure. Here also see hydrostatic pressure and oncotic pressure. Now, tell me, hydrostatic pressure, is it a favoring force or opposing force? Now, you have to ask me where, sir? Hydrostatic pressure in the glomerular capillary, it is a favoring force. But the same hydrostatic pressure in the Bowman's capsule, it is a opposing force. So, hydrostatic pressure can be favoring, can be opposing. Okay, based on the place. Now, in the same way, oncotic pressure in the glomerular capillary, see, in the glomerular capillary, it is an opposing force. But the same oncotic pressure in the Bowman's capsule is a favoring force. So, there are two favoring forces and exactly two opposing forces. Two favoring forces of filtration and two opposing forces of filtration. So, let me give you a summary here. The summary, let me write. Okay. So, now tell me, hydrostatic pressure, that is PGC, hydrostatic pressure in the glomerular capillary is a favoring force. Okay, favoring force. And how much is that value? The value is 60 mmHg, 60 mmHg. Okay. Next, any other favoring force is there? Any other favoring force? Yes. There is one more favoring force, that is oncotic pressure in the Bowman's capsule. That is also favoring force. And how much its value? That is 0 mmHg. Okay. Then what about the opposing forces? Guys, the opposing forces, look. The two opposing forces are, one is hydrostatic pressure in the Bowman's capsule. The hydrostatic pressure in the Bowman's capsule, it is an opposing force. How much its value? 18 mmHg. Also, the oncotic pressure in glomerular capillary. Oncotic pressure in the glomerular capillary. That's also opposing force. And how much its value? That is 32 mmHg. So, finally, I can conclude there are two favoring forces, two opposing forces. Okay. How much is the favoring force value? The favoring force value is 60 mmHg. And how much is the opposing force value? Opposing force value is 18 plus 32. It is 50 mmHg. So, now tell me, how much favoring forces? The favoring force is 60 mmHg, but the opposing force is only 50 mm. Opposing is how much? Only 50 mmHg. So, tell me, filtration will happen or not? Filtration will happen on net filtration pressure. So, now let's come back. What is the net filtration pressure? The net filtration pressure is favoring forces minus opposing forces. You know how much is the favoring force? The favoring force is 60 mmHg, guys. Look, let me write here again. The hydrostatic pressure in the glomerular capillary and the oncotic pressure in the Bowman's capsule, that is 60 mmHg plus 0 mmHg. How much is that? 60 mmHg. And how much is the opposing force? The two opposing forces are oncotic pressure in the glomerular capillary, that is 32 mmHg, and hydrostatic pressure in the Bowman's capsule, that is 18 mmHg. How much is that? 50 mmHg. So now tell me, favoring forces minus opposing forces. 60 minus 50, how much? That is 10 mmHg. So what is the net filtration pressure? The net filtration pressure is 10 mmHg. Okay, for favoring forces minus opposing forces is 10 mmHg. So yes, glomerular filtration will happen with a pressure difference of 10 mmHg. So because of this 10 mmHg pressure difference, the glomerular filtration is happening. Okay, done. And what is the gold standard agent for the estimation of GFR? I have already told you. Okay, I have just now explained you why GFR is happening, why the filtration is happening, because of the pressure difference. And what is the gold standard agent to estimate the GFR? Inulin. Also you can use creatinine and cystatin. Creatinine and cystatin can be used, but the gold standard agent is always inulin. Okay. Now, what is the formula to calculate the GFR? See, there is a formula to calculate the GFR. Before going there, okay, before going there, that's a recent question. Let me ask you a question, okay, which was asked in the exam. Guys, try to answer this. What happens to GFR? What happens to GFR in a patient with, condition number 1, in a patient with increased oncotic pressure in glomerular capillary? Let's say there is a patient whose oncotic pressure in the glomerular capillary is increased. Now what do you think will happen to the GFR? GFR increases or decreases? What do you think? Now first tell me, oncotic pressure is what? Oncotic pressure in the glomerular capillary. So it is pi. Okay, it's pi GC. Oncotic pressure in the glomerular capillary is an opposing force. It's an opposing force, right? So now tell me what happened in this condition. There is increased opposing force. So opposing forces increases. Now you think logically and tell me, whenever the opposing forces increases, okay, whenever the opposition increases, what do you think will happen to the GFR? GFR decreases. So understood? Next step. What do you think will happen to the GFR in a patient with a kidney stone? In a patient with kidney stone, what do you think will happen to the GFR? Okay, tell me. Now kidney stone is an obstruction, right? It's like a obstruction for the flow of urine. Now for better understanding, let me show you like this. Here is the glomerular capillary. Okay, down to the glomerular capillary, what do we have? Let's say here is a nephron. Okay, here is a nephron I am showing you. Now whenever there is a kidney stone, actually kidney stones are present in the renal pelvis. Okay, renal pelvis in the renal calyx area. Now for easy understanding purpose, let's say I am showing the kidney stone over here. Usually kidney stones don't form over here, but for understanding purpose. So here is the kidney stone. So tell me, kidney stone, is it an obstruction for the flow of urine or not? Yes, definitely it's an obstruction. So now whenever there is a stone over here, what do you think will happen to the back pressures? The back pressures will be elevated, because whenever there is an obstruction, okay, back to the obstruction, okay, proximal to the obstruction, what will happen to the pressure? Increases. So here there will be development of lot of hydrostatic pressure, because the fluid is not able to go easily. The fluid is not able to go. So there is a lot of accumulation of urine over here. That urine, the fluid, is going to exert lot of hydrostatic pressure. So now you tell me, whenever there is a lot of pressure in this area, what do you think will happen to the filtration? Do you think filtration can happen easily? No. Here there is a lot of pressure. So whenever there is a lot of pressure happening over here, exerting over here, do you think filtration can happen easily? So no. So in this condition, what do you think will happen to the GFR? Decreases. GFR decreases. Because this pressure, whatever the pressure over here, that's the hydrostatic pressure in the Bowman's capsule. See, the hydrostatic pressure in the Bowman's capsule is an opposing force. Whenever the opposing force increases, GFR decreases. So always remember, in a patient with kidney stone, the GFR will be less. Okay, so done. This is how the questions will come. So for this, you should know what are the favoring forces and the opposing forces. the hydrostatic pressure and oncotic pressures. Next guys, now let me show you what is the formula to calculate the GFR. I have told you why GFR is happening. What are the substances which are used to estimate the GFR? Okay, now I am going to tell you about what is the formula to calculate the GFR. The formula to calculate the GFR is very simple, UV by P. Okay, UV by P. So this is the formula for the calculation of GFR as well as the clearance of a substance. Clearance of a substance out of the body, the clearance of a particular drug out of the body, same formula. Now, what exactly is this U, sir? U stands for urinary concentration of a substance. It may be any substance, let's say inulin. How much inulin is there in the urine? How much inulin is there in the plasma? See what you have done, you have first injected the inulin. So first you have taken the plasma concentration of the inulin. So plasma concentration of a substance, maybe inulin or maybe some other drug. Next, what is U standing for? Urinary concentration of a same substance. How much is there in the plasma? How much is there in the urine? And you are also calculating how much volume of urine is produced in every minute. Every minute, how much urine is getting produced. Urine volume production every minute. So if you know these three parameters, plasma concentration, urinary concentration and volume of urine production. If you know these three parameters, you can estimate the GFR or you can estimate the clearance of any particular substance. For example, look at this question. See in this question, urine flow rate in a patient means urine production. How much urine is getting produced every minute? 2 ml per minute. What is the clearance? They are talking about the clearance. How much substance is getting cleared out of the body? What is the clearance? You know the formula, immediate formula. The immediate formula for the clearance is U V by P. Now we have to know what is the U value and P value because we already know how much is the V value. V value is 2. And how much is the U value given? Urinary concentration is 100 milligrams per ml and plasma concentration is 10 milligrams per ml. So let's write this U by P values. U is 100 into 2 by 10. That is 200 divided by 10. So how much is that guys? 20. So 20 ml per minute. So how much substance is getting cleared out of the body? 20 ml of the substance is getting cleared out of the body every minute. Okay, 20 ml or 20 milligrams you can say of a substance is getting cleared out of the body every minute. Okay, this much is getting cleared. So for the clearance of a substance as well as the GFR, it is the same formula that we will use. So in the recent exam, the question was something like this. The formula UV by P is used to calculate. The options was clearance. Clearance was there, so that's the answer. So with this successfully what we have completed? We have completed the Starling forces and how Starling forces affects your GFR. Hope the video is helpful. Thank you.